Hi everyone, and welcome to the Thrive at SCSU YouTube channel. My name is Nikita, and I am the graduate intern at the Wellness Center. This week is National Prevention Week, which has a focus on public education, health promotion, and prevention. Throughout this video, we will provide you all with information, data, and statistics collected from SCSU, and on and off campus resources that are available to you all. Marijuana potency has increased since the 1970s, which has increased the brain-altering effects of marijuana. There is growing scientific evidence that heavy, regular use of marijuana that begins during the teen years may lower a person's IQ. It can also increase the risk for several mental health problems, including depression, anxiety, psychosis, and result in a motivational syndrome, which is diminished or loss of drive to engage in formerly rewarding activity. Repeated marijuana use can lead to addiction. 1 in 11 adults who use marijuana and 1 in 6 who start using their teens will become addicted to marijuana. Marijuana is the #1 reason youth enter substance abuse treatment, more than alcohol, cocaine, heroin, meth, ecstasy, and other drugs combined. The percent of SCSU students who have used marijuana in the past 30 days, occasionally, which means 1 to 9 days per month, is 20.45%. The percent of SCSU undergraduate students who have used marijuana in the past 30 days regularly, which is 10 or more days per month, is 16.67%. Here's a fact. The majority of students do not use marijuana. 87% of SCSU first-year students think frequent marijuana use is not okay. Southern does provide free alcohol and other drug services. Some of these include consultations and outreach, evaluation and treatment, support groups, and Marijuana Wise program, which is a web-based prevention course. If interested in any of these free services, please feel free to reach out to Sarah Keiser, who is the coordinator of alcohol and drug services. Her information will be provided in the description box below.
Hi there, Emily here from the Wellness Center. Did you know that drug overdose is the leading cause of accidental death in the United States, and that we have had record highs of accidental drug overdoses year after year for the past couple years? When you hear about America's drug problem, I wonder what comes to mind. Because in fact, America's biggest drug problem is the misuse of prescription medications. So when we talk about misuse of prescription medications, that could be a medication that you were prescribed for a legitimate reason and that you misused. So you took more of the dose because of the way it made you felt, or you might have a medication that you were prescribed many years ago and you now use it instead for other reasons. So that's what we talk about. That's what we mean when we talk about prescription drug misuse or prescription drug abuse. At Southern, that is definitely not the norm. In the last month, when we asked students in an anonymous and representative survey, just about 5% of students said that they had taken a prescription drug without a prescription. The most commonly misused prescription drugs on our campus are stimulants, like Ritalin, Adderall, and some students might mistakenly take those thinking that they will help them stay up to study, but there's no evidence that that will help you do so. We worry when people misuse opioid prescription drugs like oxycodone, Vicodin, Percocet, other prescription drugs, because those opioids are highly addictive and they can lead to not only addiction, but people moving on to other drugs that act on your brain in much the same way, like heroin. And that's where people can end up dying from accidental overdoses. So we do have resources on campus to help students to safely dispose of medication. We have a prescription drug drop box in our health center. We have prescription disposal bags as well that we can distribute. We have resources for students who are worried about their own drug use or that of a friend or family member. Our collegiate recovery community is available to help students who are in long-term recovery. And we also have Narcan available in our health center. Or if you want to be trained in the safe administration of Narcan, you can contact us and we can train you. Narcan is a opioid overdose reversal drug. It's a nasal spray that we can give you for free, and we train you on how to use it if you ever need it. So there's many resources on campus, and we hope you take advantage of some of these.
Hi, I'm Vicki Adams. I'm the Tobacco Program Coordinator at Southern, and today I'm going to be talking with you about vaping and smoking and why it's important to think about quitting vaping during this coronavirus outbreak. So new research is showing that people who smoke cigarettes or vape are more susceptible to catching the coronavirus and are at a greater risk of more severe outcomes and complications. Smokers and vapers are more susceptible to catching the coronavirus because smoking and vaping can harm the lungs and worsen the body's ability to fight off respiratory infections. It also lowers your immune system, increasing the risk of catching the coronavirus. Smoking and vaping can increase the risk of more serious infections from the coronavirus due to lowered immune function in the lungs. Smoking and vaping increases the risk of developing chronic lung conditions, which have also been associated with more severe cases of COVID-19, meaning those who vape or smoke are getting sicker and more likely to be admitted to the ICU. Secondhand smoke or vape is also dangerous. If you're living with someone who vapes or smokes indoors, your lung health could be at risk. If you are vaping indoors, you could be harming the health of your loved ones as well. This period of isolation is the time to quit vaping and smoking. It offers more time to focus on you and your unique health goals. Quitting vaping and smoking has also been shown to decrease anxiety, depression, and stress in the long term. Quitting smoking and vaping also saves you money. It makes you free to live your life without having to rely on always needing your vape around you. Southern's Wellness Center offers many resources to help students quit. We offer quit kits that can be emailed to you directly and the opportunity to talk with a quit coach. The quit coach has helped many Southern students quit vaping through developing a plan that's uniquely tailored to each individual. Sessions are confidential and offered virtually or on the phone. You can email me directly at adamsv2@southernct.edu or visit the Wellness Center's website for more information. Thank you.
Hi, my name is Mary, and I'm going to talk to you a little bit about suicide prevention. Suicide is the second leading cause of death amongst college-age students, and according to the National College Health Assessment, about 12% of college-age students have seriously considered suicide within the past year. And whereas these numbers can seem really daunting, it's also noted that suicide is the most preventable cause of death. We all have a really important role to play in preventing suicide. And there are different ways that we can do to support people. And this support can look like being willing to ask questions and support someone and helping them get to the resources that they need. I'm going to share a few numbers with you now. So here at Southern Connecticut State University, we have counseling services. And the number for that is 203-392-5475. And then you also have 211. And on the back of your Hoot Loot card, a lot of people don't know this, but there's actually the number for the National Suicide Prevention Lifeline. And if you don't have that number on the back of your card, the number is 1-800-273-8255. So there are various things that we can do to support each other. And I would encourage you all to be aware of various resources that you can share or things that you can do to support each other. We all have a really important part to play in this.
Hi, my name is Jeff and I work with the Wellness Center focusing on alcohol outreach. Specifically, we've collected data from Southern students to create Southern-specific messages on social norms to reduce risky alcohol consumption, such as binge drinking in our community. For example, some of our messages include that based off the data, the majority of SCSU first-year students did not binge drink within the past 2 weeks, and that 3 and 4 SCSU first-year students chose to drink moderately or not at all at parties. We encourage anyone who would like to talk to somebody about any alcohol-related concerns to contact Sarah Keiser, coordinator of alcohol and drug services here on campus, as well as to contact or visit the Wellness Center for any additional information.